Right. Hi, everyone, and thank you very much for coming here today. And welcome to SUPA's first international webinar. I first like to introduce myself. My name is Elissar. I'm a fourth-year Bachelor of Pharmacy student, and I'm also the president of the Sydney University Pharmacy Association. And if you're joining us from Sydney, then you probably know us as SUPA. So in Australia, we always start our events by acknowledging the traditional custodians of the land on which we're joining from today. So I'm joining you from the land of the Wangal people of the Eora Nation, and I'd like to pay my respect to their elders past, present, and emerging. And I'd like to acknowledge all the lands that you're joining us from today as well. So first off, I'd like to thank our wonderful speakers for coming today and for dedicating this time to speak to our students. So today we have Aaron Johnson joining us from Florida in the States. We have Seema Nayani joining us from Toronto in Canada. We have Jochen Pfeifer joining us from Germany, from Velbert, and we have Christine Bao joining us from Sydney, Australia. Thank you again for coming. And I would also like to thank Rita Huang, who that I can see that she's with us today. She's the IPSF CAPC liaison, and she's been very helpful in making this event happen. So thank you, Rita, for joining. And yeah, I'd also like to thank all of you guys for coming today. And I acknowledge the presence of our students that are joining us from around the world. I know we have some students from the University of Newfoundland and Labrador, and some students from the University of Frey in Berlin. So just to briefly go over the schedule for today, we will first start off with Aaron, then Seema, then Jochen, then Christine. And
give me this.
Yep, sorry. And each of the speakers will essentially talk to you about their journey on how they became the pharmacists that they are today. And they will briefly tell you how you can become a pharmacist in each of their respective countries. And from there, they'll mainly focus on the role that they've been playing as pharmacists and healthcare professionals within the last 2 years. That, as you guys know, pharmacists have played such an essential role. And this is why we're here today, to acknowledge the crucial role that pharmacists have played in the last 2 years with the pandemic. So if you have any questions, we will have some Q&A time at the end of each presentation. So leave them till then. Feel free to put them in the chat or on mute once the speakers are done with their presentations. So without further ado, I'll present our first speaker for tonight. So Aaron Johnson, he's a doctor of pharmacy with a passion for health philanthropy, and his interests include mentorship, health equity, and helping the underrepresented community. Aaron's the founder and chairman of the Aaron Johnson Scholarship, which supports underrepresented students in the Broward County area in South Florida. And through the scholarship, he's been able to partner with healthcare organizations to create a positive impact in the community. So Aaron, I'll pass it on to you.
All right, good morning, or actually good evening. Everybody's kind of in a different time zone. Lester, if you could just share my PowerPoint, that would be great. But thank you everyone for being here, whether it's the morning or the afternoon or evening. Really appreciate it.
Just let me know when you want me to go to the next page.
I don't see anything on my end. I don't know if that's just
there we go.
I got it now. Perfect. All right. All right. So yeah, like the title suggests, I'm just gonna go through a little bit about my journey, and then towards the end, talk about the role that pharmacists in the U.S. played during the pandemic. Just for some background, I graduated. I guess next month will be a year, so I haven't been graduated too long. I kind of walked in right in the middle of the pandemic, so definitely an interesting time to start practicing. Usually you go through a residency and they start giving you advanced things. I walked right in, they're like, oh, do this, do this. So it's been a cool experience, but a tough one at the same time. Next slide. So yeah, that was me in pharmacy school. I think I look kind of the same, a little bit more wrinkles and bags under my eyes, but pharmacy school would do that to you. And so I just wanted to get into the point where pharmacy actually kind of fell in my lap. It wasn't really planned. as you get older, you start realizing that 9 times out of 10, when you plan something, it doesn't go the way you expect. And pharmacy was no different for me. I'll talk a little bit more about that journey later. Next slide. So yeah, during undergrad, like I mentioned, I actually didn't want to go to pharmacy school. I was trying to pursue nursing school. And then things didn't work out. I'll talk a little bit more about that next slide, but currently have 3 different careers. So I actually just stopped my clinical pharmacy job because I'm stepping into another role in the next couple of months. So I'm going through contract negotiations with that. But I was a clinical pharmacist at a hospital for 10 months, sorry. And I run my own scholarship organization, which I'm really passionate about. You know, we financially fund students to go to university. So, and we do a lot of different things in terms of mentorship programs and things of that nature. So I'm really passionate about that. I do consulting with health systems and for diversity, equity, and inclusion practices. Are the practices for the colleagues as well as the patients? Are they the best practices for inclusivity? Are we doing the right things? Do we have the right drugs on formulary to meet the needs of every population? So that's pretty cool. I'm doing that at a pretty young age, so I have a lot of fun with that. And that's kind of the role I'm gonna step in next, but I can't really talk about that. And then I also own a cleaning business, totally random, but I have a cleaning business on the side, and that's definitely helped funding. I get somebody on. This is why we always mute our mics on Zoom. My greatest achievement, I'd say, probably is my scholarship. I'm really passionate about that. I love giving back, and given my background of how I grew up, I wish somebody, I had a mentor, somebody that would help me when I was that age. So that's really what I'm interested in, and I'm hoping to achieve essentially a position in pharmacy where I can use my background in helping underrepresented populations achieve equitable access to healthcare and see representation of all people reflected through healthcare from top to bottom. From the janitor to the CEOs. We live, especially in Florida, we live in a very diverse population, and so I've always thought, how can you care for the population when everyone looks the same, right? That's just not how it works. So I really want to see that. Fun facts, I'm not that interesting, but I used to be a personal trainer for a couple of Miami Dolphins, which is a football team, some of their players. So that's kind of cool. I volunteer with the Global Alliance for Medical Education, which is an international organization that facilitates best practices for medical education. It's a CME, CPD community. So that's pretty fun. And when I was 15 years old, I'm not sure if you know the game Mario Kart. I was the number one, there's like something that called time trials, and I had the fastest time in Rainbow Road for like a year. It was pretty dope, but yeah, that's the only fun fact about me. Next slide. So yeah, like I alluded to earlier, pharmacy school didn't really, it wasn't planned. I applied to nursing school. I didn't get in. And at the time I was devastated, but honestly, it was the best thing probably that ever happened. And, you're going to face this throughout your career, through school, things just aren't going to go your way. And it's not really, it's 10% about what happens to you and 90% of how you respond to it, right? And so for me, I didn't get in. And so I was like, all right, let me just get a degree in biology. So at least I have something to do. I want to have a background. I don't know what I'm going to do with this bio degree, but I have it. And so I ended up getting that biology degree, and I graduated, and I'm like, I don't really know what I want to do. So next slide. So I ended up getting a public safety job at Nova. Like I was like, I don't know what I want to do, and I don't want to go into a field that I don't like. So I got a public safety job on my year off. So I graduated a year late, and then I took a year off. So I was like 2 years behind. And I was working doing public safety, and I always got the health building for whatever reason. I was working like the overnight shift, like the 11 p.m. to 7 a.m., the shift nobody wanted. And I always got the health building. And so while I was there, I started developing relationships with people. I didn't know who they were. I just would say hi, good morning. And one person was like, hey, what did you major in? I was like, biology. They're like, you should apply to pharmacy school. Now, I didn't know anything about pharmacy. I'm like, I know they give out pills, but I don't really know much about the career. And he was like, I don't know. We're just looking for, qualified applicants. If you have a decent GP, you should apply. So I said, whatever, I applied. I had no idea at the time that this person was the dean of the school. I had no idea. And so I applied and I got in. And that's kind of just how my journey started. And I've just been able to have so many different opportunities from pharmacy. And like, I really do believe it's whatever you make of your degree. It's as valuable as you make it. Some people, they just go to school and, they get good grades and they leave, and that's fine. But, it's a versatile degree and you can do a lot of things with it. So yeah, I got into school, and then next slide. And then, yeah, like, just things kept happening. I was never a great student, right? Like, I was always like a, 3.0, 3.1, never really had great grades. And once I got to pharmacy school, I don't know, I guess I just started studying harder, or I started to actually care about, what I was learning, and I started doing really well. And, I think sometimes, like, you just get put on a path that is right for you. And I think that's what happened with pharmacy school. Next slide. And then one thing just kept leading to another. And I always just said yes to new opportunities. So me and my classmate, we started this podcast, and we've had health executives, CEO of Cleveland Clinic. You see right there, we had a Nobel Prize winner on the show. And I've been able to meet a lot of different individuals, not just in pharmacy, but around the world in general, just because I'm a pharmacy student, and like, I leveraged my degree to do a lot of these cool things. So, one thing just keeps leading to another. Next slide. And then, yeah, once I started doing that, I started getting more speaking engagements like this. I was a keynote speaker at a Rutgers event. I'm just trying to, like, drive home the point where you can do whatever you want. You don't just have to go into retail. You don't just have to go into the hospital. You don't just have to go into the research setting. You can do a lot of different things. Next slide. I think I'm almost done with this part. And then, I started a scholarship, and I think this is kind of where I'm meant to be in the equity and inclusion space. So definitely been a lot of fun. Next slide. All right. So obviously the main question, like, why are you here? How do you become a pharmacist in the US? So once you graduate high school, that's step one, graduate high school. You go to university, or we call it undergrad here, and you have prerequisite courses. So you have to take chemistry 1, chemistry 2, organic chemistry 1, organic chemistry 2, anatomy and physiology, statistics, and I think there's like another math class, I think college algebra. Now, in the US, like, you can choose to either go and just go directly for those classes, which will take you about 2 years, or you can take the safe option and get a bachelor's degree. So just taking the courses will take you about 2 years. But if you go and try to get a bachelor's degree like I did, because I wasn't 100% sure what I wanted to do, it takes you 4 years to get a bachelor's degree. So if you 100% know that I'm going to pharmacy school, you can just take the classes that you need to and just skip the bachelor's degree and get your doctorate. So yeah, I went the biology route and got my bachelor's because, like I said, I didn't know. Pharmacy school itself takes 4 years. The first 3 years are didactic. Didactic just means you're in the classroom. So your first 3 years, you're in the classroom, and your whole 4th year is rotations. So every 6 weeks, you're going to a different rotation site. So you have internal medicine rotation, you have community pharmacy, you have like 3 electives that you can pick, advanced hospital rotation, where you kind of learn everything, and then advanced community, where it's like your community retail rotation, like on steroids. And then you can choose when you graduate whether you want to take a residency or not. So in the States, specifically in Florida, it's very competitive to get a clinical job. Unless you know somebody, you almost have to have a residency. So residency is postgraduate training after you graduate, and you can do either 1 or 2 years. People that do 2 years, they typically specialize. So your first year residency is very general. And then your second year, like, you can specialize in oncology, neurology, things of that nature. And then once you graduate, you get the doctor of pharmacy degree. Scope of practice, there's a million things you can do. I just like kept this brief because we have a lot of presenters. Pharmacists can vaccinate, compound, dispense. Dispense is going to be your main thing you do, and prescribe a select few of medications. Now, this varies a lot state to state. In Florida, there's about, I think, like 8 or 9 things we can prescribe, and that has to do with some of our legislation in terms of test and treating, and then do you have a collaborative practice agreement, things of that nature. So I'm not sure how it works over there, but state to state, your what you can do varies a lot. A lot of things like in states that are literally right next to us, we just can't do. So that's what really makes a difference. Next slide. So yeah, this is just a quick overview. I thought this was like probably the easiest way to explain some of the legislation. So our scope of practice, essentially, there's like a million laws and bylaws, but your dispense, you're supposed to make sure that you're giving the right medication to the right patient at the right time, things of that nature. But one of the big things we're pushing here in the US is establishing those collaborative practice agreements. So a collaborative practice agreement is an agreement that you go into with a physician or physician group, and it allows you to give specific recommendations or medications for chronic diseases like diabetes or arthritis or things of that nature. So typically, obviously, we're not pharmacists. They don't prescribe. But if you have this collaborative practice agreements with the physician, you can do those sort of things. Also, we're pushing for provider status, which would allow us to prescribe. That takes a lot of money and litigation and things of that nature. But that's kind of what we're going for. Testing and treating of minor non-chronic health conditions. That is something that I think is about a year or two old. So essentially, if somebody comes in and we can test and treat them for strep, influenza, lice, and we can also give them the appropriate medication. That we didn't have that right about 3 years ago. So, a lot of things change as time goes on. And in America, a lot of things have to do with money and politics. And it's just the reality of it. And if you have the right lobbying power and the right people making changes and on the White House, then things will happen. It's just the reality of it. Next slide. So yeah, the pandemic, like I said, I started working in the middle of the pandemic. Like I just graduated. It's like, all right, so you're gonna be on the intensive care unit. I'm like, what? So that was a bit tough. I came out of school and I'm working in the ICU. To me, the hardest part of going through the pandemic was really we just didn't know like everything. And so you're going off what you learned in school. I don't have any real practice experience at the time, so I have to go off of everything I learned in school and go on the fly and learn things. So it was tough. The first case was in January 2020. It was probably before that, but the first reported case was then. And the case numbers in the US varied a lot. Like Florida and New York were like very bad. But other places, they still were bad, but not as significant. So it really depended on where you were. But with me being in Florida, between March and May of 2020, it was, it was tough, seeing people go on ventilators and not ever coming off. That was hard. Healthcare, the worker burnout was tough. A lot of institutions didn't have PPE. I mean, no ill intent to my previous employer, but even sometimes we had to share N95s, and it was just the reality of the situation. A lot of healthcare systems just weren't equipped to handle something of that nature. But we learned and moved on. Social life, obviously, as you know, was significantly impacted. Mental health had been deteriorating, and not just among the population, among the healthcare workers too. Two of my employees quit because they just couldn't handle it. It was a lot. It was a lot. Definitely a lot to deal with. But we did our best, and just got to look forward, right? So next slide. So yeah, this is the case numbers of over the past 2 years. So I literally started working in March, right when it started. So awesome. but yeah, it got really bad around March, April, and May. And during that time, we were running out of things like propofol, things like to put people on vents. We were running out of that stuff. And, it was hard because sometimes we couldn't put people on a vent, and then unfortunately they passed away. So it was tough, but I just want to give you just kind of how it's been going in the US. As you see, it got really bad right before the vaccine. And then after everybody started getting vaccinated, it was good. But now people are getting comfortable, not getting boosted, things of that nature. So it's a tug of war. It's not going anywhere. We're just figuring out how to deal with it as best we can. Next slide. Yeah, so like I mentioned earlier, the hardest part were just there weren't any guidelines, right? Usually I'll go to the IDSA, which is infectious disease society, and it's like, oh, just find whatever the disease state is, and it tells you what's first line, second line, third line treatment. But for COVID, we didn't have any guidance, so obviously you had to use your clinical acumen and judgment. But the thing you have to understand is I was new, so like I didn't know that. Like I there are a lot of things I didn't have an experience to do. And since the guidance wasn't clear, there were some order sets. An order set is just like, if somebody has this is what we give, but it varies between physicians. So some order sets would have vitamin C, zinc, and antibiotics, which to me never made sense, because why are we giving an antibiotic for a viral infection? But anyways, and then other people's order sets didn't have it on, and I'm like, which one is right? And nobody knew. So it was just hard. The lack of knowledge was really the hardest thing to deal with, and obviously the lack of PPE was tough too. And then it's like, do I give remdesivir? Do I give hydroxychloroquine? Do I give a protease inhibitor? Do we actually need antibiotics? So it was a lot to deal with. And then the thing about COVID is you're looking for different inflammatory markers, right? But some are different. Like the inflammatory markers are, CRP, C-reactive protein, ferritin, ESR, erythrocyte sedimentation rate. But sometimes I didn't know which one was the most specific, and ordering tests for all these different ones was just too much money. So it was a headache. But the good thing is, in every situation, good things come out of it. And so the explosion of virtual counseling, telehealth, things that we didn't think would come to fruition for years, we literally brought in within a couple of months. MTM services and managed care pharmacy are going to be very big. And a lot of what they give to the pharmacy profession really came out. And before the pandemic, very few pharmacies offered testing services for infectious diseases or viral services such as COVID. Now many have added that service to help the country combat the virus. So a lot of the things are just being streamlined a lot faster, and our roles have been expanded tremendously. Of course, we're the main people that are doing all the vaccinations. Retail pharmacies, they're doing most of the vaccinations, right? So on top of all the other things they already do. So I think it's just really a good time. Like I mentioned, advocating and making sure legislation get passed. Right now is the perfect time, because you can actually quantify the amount of work you've done. Like, look how many vaccines we've given. Look at our numbers. Like, look, this is how many medication we've been dispensing, X, Y, and Z. Like, this is the perfect time to advocate for your profession. A lot of the times people don't see the work because you can't quantify the numbers. Now you can. So, and then the pharmacy practices are expanding, decreasing PBMs hold on the industry. I'm not sure if everybody else in the other countries have PBMs. Those are pharmacy benefit managers. They're like the worst things for a retail pharmacy. They're like the middleman. I'm sure all the retail experts know about that. So we're trying to decrease the PBM holds on the industry, and just creating for more advocating for grants and things like that that lets pharmacy be more flexible. But you have to get those collaborative practice agreements at provider status to be able to expand a lot of your services. So we need to be our own cheerleaders, essentially. Next slide. And yeah, this is my inspirational quote. I'm not much of an inspirational quote type of person, but by the great Michael Scott and Wayne Gretzky, you miss 100% of the shots that you don't take. You saw throughout my journey, I'm not the most qualified person. I was not the top of my class or anything, but it was really important. Personality is what's going to set you apart from everybody else. When you graduate, everybody's going to have the same exact degree that you have, the same exact degree. What relationships did you build? How did you treat people? What network did you build? That's what's really going to separate you from someone else, because especially here in the States, everything is very competitive. And when you apply for a job or a residency, the first thing people will do is just call up other people and say, do you know this person? Or they'll see what connections you have. And that's just the reality of it. So definitely don't be afraid to take opportunities you're going to miss sometimes. That's just part of life. But just go for it. And I think my next slide is the last one. Yeah, for me, my biggest takeaway message, of course, pharmacy is an amazing field, but for me, what it's done for me is actually a little bit more important. So definitely network. What you know is extremely important, but who you know is just as important. And that's just the reality of how life is. So right now, take advantage of all of us being here. You have 4 different individuals from different parts of the world that you now have a network with. Like, reach out to us after the presentation. Like, things like that matter. I've given the presentations to I think over 30 different universities, and I always have one student that reaches out to me, and most of them either work on my scholarship staff or I've hooked them up with other people. So definitely take advantage of that. I think that's it. Next slide, I think is my last one. Yeah, so the best way to contact me is through Instagram. I don't really answer emails, like, not gonna lie. Like, I will, but it'll be like a 5-day delay. If you hit me up on Instagram, I don't really check that either, but at least I'll check within an 8-hour span. So I'll give everybody a moment if you want to connect with me. If you don't, that's totally fine. I get it. But yeah, if you want a decently fast response, hit me up on Instagram and I'll try my best. Sorry, I went as fast as I could. Sorry about that.
Thank you very much, Aaron, for that. I mean, you said you're not a very inspirational quote type of guy. I think you're an very inspirational pharmacist in person, and I think a lot of students will relate to all these experiences that you described. And that rejection also doesn't mean that it's the end of the world. So thank you for that. Does anyone have any questions for Aaron?
I've actually got one for Aaron. For people, for example, pharmacists, say in Australia, looking into the US, and I know we spoke about it before, like how the US has a lot of opportunity for research and stuff. How sort of easy or hard is it for pharmacists to sort of qualify and like be able to practice in the US? Like, what would you need to do? Or
yeah, so that's a very good question. So you have to, if you're coming from out of the country, there's two things you can do. Either you can go, like Nova has a program where you can essentially go through pharmacy school again, but it's an accelerated program, or you get a certain amount of hours shadowing somebody, and then you take your board exams. The amount of hours is something like 1,500. It's a lot of hours, but those are the main two options. So yeah, like we in my class we had an accelerated program. So we had people from Jamaica, people from different countries, India, things of that nature. And they have an accelerated track. It's like I said, it's usually 4 years, but for them it was 3 years. But they also had to pass different exams that I didn't have to pass. So I'm not gonna lie, is the barrier of entry tough? Yeah, I'm not gonna lie to you. But it is there, and it is an option if you're willing to, go through another 3 years.
fair enough. Do you find that a lot of people sort of do that? Like in your classes, you said
we had, I graduated 2 years ago, and we had, I say, 40 people that were in that program. The thing is, there aren't a lot of those programs. I think there's only about 4 in the US. I just happened to go to one of them that had it. So yeah, it's either that option or you get your shadow hours and pass the 2 exams that on top of your board exams that you have to pass. So the barrier of entry is high, but pharmacy, and especially in the state that I live in, is a saturated market. I'll just be honest. So that's kind of what you have to deal with.
Fair enough. Thank you.
Yep.
I had a question as well. Hi, Aaron. Then you dealt with the stress during the COVID pandemic, and like what you did to help deal with stress.
Yeah, I naturally just don't really get stressed. I'm pretty I don't know. I'm happy to be alive. I grew up in the hood. So for me, yeah, not a lot of things really stress me out, but I work out every day. That really helps me. I work out every day. I still do personal training. So having that just implemented in my schedule. And I mean, I have a good life, like I have a good career. I have a very supportive family. I'm healthy. So for me, I think it's kind of not fair for me to answer this question because I'm just in a better position than a lot of people, and I'm blessed to be there. You have to be balanced, right? Understand that people were going to die in the pandemic, and it was just a reality of it. At the same time, also understand that like I was doing the best I could to make sure people didn't. So you got to have that balance. But yeah, I think finding whatever works for you is really important. For me, it was the gym. For some people, it was watching Breaking Bad on Netflix. Everybody has their thing. I think you just need to find it. Too many times people don't end up, finding their vice. So that's what's really important.
Awesome. Thank you.
Yep.
Thank you for that. If you guys have any more questions, you feel free to put them in the chat. And Aaron, would you be happy for me to send you any other questions? Because I'm
Yeah,
just
that's fine.
mindful of time. Is that
Yeah, that's fine.
Yep. Okay, great. If you do have any questions, just put them in the chat and Aaron can answer throughout unless you need to head off. Otherwise, I'll send them to Aaron by email. So thanks again for the presentation. I know a lot of students will take a lot from it. So I'll just move on now to our next speaker. So Seema Nayani, she's a pharmacist and senior manager at a national not-for-profit organization that helps implement digital health initiatives across Canada. She also provides clinical expertise on a number of initiatives, including Canada's National E-Prescribing Service. She's also a practicing community pharmacist and continuously looks for opportunities to improve the patient and clinician experience in the healthcare system. So Seema graduated from the University of Toronto and holds a certification in healthcare information and management system. And she's also a board certified geriatric pharmacist and a certified diabetes educator. I'll hand that over to you, Seema.
Great, thanks, Elissar. And I'm just going to share my screen. And I hope everyone can see that. All right, let me just put it into slideshow mode. There we go. All right. Okay, well, thanks everyone, for joining from around the world, and very exciting to be able to have this conversation with everyone. So I'm talking to you from Ontario and Toronto in Ontario, which is right down here. Kind of good to put it into perspective where in the world we are. So you can see Canada is quite a large country. We have 10 provinces and 3 territories. And why that is important is because our healthcare system is actually considered decentralized. So each province and territory administers their own healthcare. So they almost act like an individual health authority. And each province or territory sets their priorities for healthcare. So you can just imagine you might get a different flavor of priorities and healthcare outcomes in each province and territory. And that was actually quite important. I kind of had this realization when I was putting this presentation together, is that really how your healthcare is structured in your country can really impact the outcomes that you'll see. And I'll go into a little bit more detail throughout the presentation. All right. Oh, my slides aren't. Oh, here we go. There we go. So a little bit before, just again, the note about the healthcare in Canada being decentralized. So I'll jump into a little bit about my journey in pharmacy. I've been out of pharmacy school a little bit longer than Aaron has. So, the details of what's required for being a pharmacist in Canada have quite changed since the time I went through. Previously, when I went through, you needed a minimum of 1 year undergrad, and then you would do a 4-year degree. Now, I believe to get the requirements that you need for pharmacy school, you need really about 2 years undergrad, and then it's a 4-year degree program. And most of the schools are transitioning to a PharmD program. There are 10 schools of pharmacy in Canada, so not all provinces and territories have a pharmacy school. Say in Ontario, we actually have 2 pharmacy schools. And so I had gone to the University of Toronto, and it was very interesting, similar to Aaron's experience. I kind of had the same, interesting path where I even didn't think about going into pharmacy. I was, did a biology degree. I thought, this is my passion. I'm going to go into research. And my last year of, my honors degree, looking at a Petri dish, and I was thinking, boy, I have to get a job where I can talk to people. So I started actually I graduated, and then I started doing some research, shadowed a pharmacist, spoke to different colleagues. I had a colleague in the pharmaceutical industry, and they really encouraged me to apply to pharmacy. So I said, okay, let me try, see if I get in. I got in, and I was like, okay, I guess I'll try this. And, from the first few classes, I was like, yes, I made the right decision, and just kind of never looked back. Throughout my time at University of Toronto, whatever rotations we had, I always really loved the community pharmacy focus. So that's where I ended up focusing my career. But I would say it's had many pivots. So I've had a lot of those traditional roles in community pharmacies. As a student, I was a pharmacy assistant. When I graduated, I was a staff pharmacist, then a pharmacy manager, then a pharmacy owner. But then I also, when I became a diabetes educator, I worked in a clinic setting and an endocrinology clinic where I was actually given medical directives, and I could, adjust patients' medications independently, and that would be considered like the role of a prescribing pharmacist in Canada. I also became a board certified geriatric pharmacist and worked in home care. And that was just really eye-opening because it wasn't only pharmacy based. So I actually would work with patients transitioning from hospital to home. And often, as we know, that's a very, fragile period for patients and very error prone. So my main job was actually medication reconciliation, which is a very unique position in Canada. It's not commonly a paid position just to do medication reconciliation. So I can just imagine, as a pharmacist, I was just in my peak. I love that, but I found that it was so hard to get the information that I needed to really, help my patients, because say the pharmacy would have some information, the hospital would have some information, maybe another pharmacy would have some older information, the doctor would have other information. Everyone was using their own, digital solutions and, clinical systems. So it really helped me to see and appreciate how information did flow or didn't flow, to benefit a patient. And then after that, I made another pivot, and now I work in digital health and working on Canada's national e-prescribing service. So I know in a lot of countries, e-prescribing is, old hat. It's been established for a while. For Canada, it's only been about 5 years that we've been rolling this out. And interestingly enough, in Canada, it's a voluntary program. It's not mandated. So you can just imagine, pharmacists and prescribers who have signed up, it's really, they're interested in that service, but not everyone was clamoring from the beginning. And interestingly enough, during the pandemic, we've seen, further growth around e-prescribing. And we were really happy to hear that once we've talked to all the provinces and territories, and they've agreed that e-prescribing is a priority for them. So we actually have on board and, prescribers and pharmacists in 6 provinces right now, and with all the others hopefully coming on soon. Along with my work in digital health, I've been also working on a online educational series. It's called Informatics for Pharmacy Students. It's with the Association of Faculties of Pharmacy of Canada. And basically these are, little educational tools. It's actually free access. And it teaches pharmacy students about health informatics because, as I learned, digital health is so important for us to be able to support our patients and understanding how to get that information and what is the optimal way as well. Because I found in digital health, a lot of times the solutions that are rolled out are by non-pharmacists or non-clinicians and are rolled out by a lot of business folks. So we really need a lot of more clinical folks in this domain to really advise how these solutions should be designed and, how should they look and support the clinician to help patients. So currently my focus is to improve the patient and the pharmacist experience. So a lot of times we focus primarily on the patient experience, which is very important. But again, the pharmacist experience sometimes is kind of overlooked, that, how difficult is it for you to do your job? And that will really, impact your, potential burnout in that job, your ability to enjoy your job. So that's really where I like to focus my work right now, having an appreciation for the way that the information flows between clinical systems. So for example, in e-prescribing, how does that information go from the prescriber to the pharmacy, and having it in a digitized form that can be consumed by each system? Because in some implementations, say in other countries, that information actually goes almost like an email. What we're trying to do in Canada is actually have that information go from system to system and be usable in that receiving system. So also I work on workflow and product excellence, and we're also working on a national standardized medication terminology for digital exchange. So that way the information in a prescription can go safely from the prescriber to the pharmacist. So moving on to how Canada, lived through the pandemic. So the first community transmission in Canada that was detected was early January 2020. And this was considered our first wave, and it lasted about 5 months. Our peak of cases was late 2020 to mid 2021, which is considered our second and third waves. And just to put in perspective, Canada's in a sixth wave now, and we're actually seeing cases that are rivaling the peaks that were seen in 2020 and 2021. So in Canada, the per capita number of beds in hospitals and ventilators were quite low. So to protect that hospital capacity, there was a lot of stay-at-home orders implemented across Canada, which of course impacted businesses, schools, and the economy. Luckily, the government provided a lot of financial aid to businesses and individuals who had lost their jobs. Also, schools, there are a lot of online learning. Unfortunately, for a lot of young people, that was a huge impact, even for, say, university students. A lot of them couldn't do their practicums and rotations. I still even remember lineups at stores just because the capacity, say at the grocery store, was only so many people, and you had to line up even in the winter to get into that store. So, very things that no one had ever experienced, in our lifetimes that we had even remembered. For each province and territory, there's a chief medical officer as well as a premier, and the premier is considered the leader of the government. So each of them had a bit of a different role during the pandemic. So the chief medical officer, set down the mask mandates, testing and contact tracing requirements. However, the premier wasn't responsible for other matters such as vaccine passports, long-term care practices, requirements around socializing and travel. So for example, we had these concepts of bubbles. I'm not sure if other folks are, familiar with this term, where, if you're in one family, you could socialize with one or two other families, and that's considered your social bubble. In Eastern Canada, there wasn't a lot of cases in many of the different provinces. So they were actually, within a geographical bubble. So if you lived in one of those provinces, you could still travel within the bubble. But unfortunately, because of the number of cases right now, there's no geographic bubbles anymore in Canada. Interesting enough, also the premier would also set acute care activity, for example, pausing of scheduled surgeries. So you can see there was sometimes some very, clinically minded folks making decisions, but there was also sometimes some more political and business minded folks making other decisions. And that combination really gave us some variable outcomes in each province or territory. So you would see in some provinces, even though there was a high population, you not necessarily would see the same number of cases or even the fatality rate. Overall in Canada, we found the biggest impacts in long-term care homes and their residents. Unfortunately, in Canada, long-term care homes haven't been well funded over the years. A lot of them had very poor ventilation, not the proper support staff. So we did see a large proportion of overall fatalities in Canada in long-term care home residents. Also, just as Aaron had mentioned, there was those mental health impacts. I believe there was a survey done in Canada, a national survey in spring of 2021 that basically 1 in 4 Canadians reported having anxiety, depression, PTSD, and largely attributable to social isolation. And then the role of the pharmacist. So pharmacists are known to be the most trusted and accessible healthcare professional in Canada. So a lot of primary care providers were closing their doors. Pharmacies still were open for walk-in patients. There was not a day that we really closed. So even though I still work full-time in digital health, I still practice on weekends in community pharmacy. So I was kind of getting an interesting mix of what I was seeing. So during the week, I got to work from home and things seemed, pretty relatively normal. And then on the weekends, I was in the pharmacy seeing all the, concerns that were being brought up by patients. In practice, we were seeing medication shortages. Even the government was only allowing us to bill for, say, 1 month's supply initially at a time because we didn't know how much medication would be available. Even the availability of prescribers, many were just not available, answering the phone, answering their faxes, because many prescribers began to work from home and they didn't have all the facilities. Say they didn't have a fax machine at home, so they didn't get their faxes. So it was a bit challenging to, fill those gaps of care. There were staffing challenges, as people were getting sick. There was, lack of PPE as well. So all of those factors that, everyone's seen in other countries, we also saw it in Canada. Also, the scope of practice of pharmacists varies based on the province or territory. We all have a little bit of different flavor of what you can prescribe, what injections can be given, and ordering of labs. So some of these were modified during the pandemic. So for example, because we had such the volume of patients coming to pharmacies for vaccinations, pharmacy technicians could be trained to give vaccinations as well. And interestingly enough, Health Canada, who oversees the national regulations for medications in Canada, they provided an exemption for certain requirements related to controlled substances to enable patients to obtain their medications more easily. For example, we could accept verbal prescriptions in cases where we previously couldn't. We could do deliveries of certain controlled substances where we couldn't before. So it was all very interesting to see these, small changes that were being made, but really helping patients to maintain their care. So I felt like pharmacists played a crucial role in helping patients, definitely, navigating those gaps in care. For example, in Canada, we can extend chronic medication prescriptions. So a lot of times if a patient couldn't get a hold of their doctor, couldn't get an appointment, we could extend their prescription. There was a lot of addressing misinformation. I think every single day I went into the pharmacy, our phones were ringing off the hook. Just trying to get, people were just trying to get information about COVID and what to expect, about vaccinations, where can I get a vaccine, what is the current dosing schedule, even where to get tested. And pharmacists are continuing to support those really vulnerable populations, so especially older adults. I had one patient, she had COVID, she was in a retirement home, and she couldn't get out to get her, antibiotic prescription. At the time, we didn't even have a delivery person, so my pharmacy assistant went and dropped it off. So, folks just stepped up where they had to. Also, people with substance use disorders really needed a lot of support. So the pharmacies I work at do methadone maintenance treatment. So some of those folks, if they had COVID, how could we administer their methadone? So we would have it delivered. We could have carries done. We could do virtual appointments where we would see the administration of the methadone dose. Also, those with chronic diseases, like say, for example, diabetes, they needed to make sure they weren't running out of their medications, getting the touch points with a care provider, because a lot of the specialists weren't available as well. And of course, those with mental health conditions, we wanted to make sure they didn't run out of their medications as well. So, I thought this, saying is quite fitting for what we've been going through. In the middle of difficulty lies opportunity. Albert Einstein was quite an influential figure, and always kind of looked to him to see, inspirational thoughts. So of course, the pandemic has been a very difficult time for all of us, but opportunities for pharmacists have been fantastic. We've really been able to step up. Same thing with like virtual care has, literally exploded in Canada. By a lot of prescribers previously, it was seen as like secondary care, not important, but it's just being so well received now. Basically, everybody wants to do virtual care now. And what was interesting, the governments followed suit by paying prescribers to do these appointments. Before, it was very much a contested issue in our politics, but it was great to see this, kind of help to fill those gaps. Same thing with greater focus on mental health and long-term care funding. So there is a lot of, opportunity that's come of, what we've seen during the pandemic. And just, I guess, just final thoughts, that the pandemic has really highlighted the importance of pharmacists within the healthcare system. And, I think the pharmacists will continue to play an expanded role. increasing access to care and reducing that pressure on healthcare systems. And just like, Aaron has done, I've done the same thing where you start pharmacy and then you pivot into different areas. And I think really what you're passionate about, you will learn to just follow your instincts and use your, base training to pursue what you're really interested in. It could be, anything that could be related to pharmacy or maybe not. So I think pharmacy is a really good basis to have, a lot of opportunities. And, I just can see just the opportunities continue to expand. So thanks so much for your time today.
Thank you, Seema. That was such a great presentation. And what I love about your journey is how diverse it is. This is just an example of, all the things that we can do as future pharmacists. And it's really great to see, an example of someone that's been involved in so many things. And I have to say, you're working in pretty much 7 days a week.
I think it works out to 6 days a week.
Even 6 days a week. That's
yeah.
I think that's amazing. Well, thank you for this presentation. Does anyone have, actually, yes, there is a question in the chat. So a question from Helen, is there anything you would have done differently now that we know more about COVID in terms of digital health?
And it's interesting. I was always a big proponent of digital health. I think even about at least, like I've been working in digital health focused work about 5 years ago. Even before, I was a big proponent of it already because I saw how it helped, all those patients I was helping transition from hospital to home. I guess the only thing I would have done is maybe try to push more people to adopt it. But unfortunately, until that payment of virtual care didn't fall into place, it didn't really get taken up, unfortunately. So I think just, wherever you can, if you're interested in digital health, using those tools. I was always an early adopter. So even when I worked in, traditional pharmacy roles, I'd have the random, app developer show up and say, hey, can you just give me your opinion on this? Because they knew I was interested in that area. And so, wherever I have an opportunity to kind of give some input or clinical insight, I always take that opportunity. Even when I worked on the informatics for students project, I still have students who reach out who are, in the midst of developing their own solutions right now, and they just want to bounce things off of me. So I really, like to, encourage those opportunities. So likewise for anyone here, if you're interested in any different avenue, just taking the time, whoever it is, just chatting, seeing where there could be some synergies is always, useful.
Thank you for that. We also have another question from Christian. So what type of vaccines can pharmacists administer in Canada? Because in Australia, we only have 2 types of vaccines that we can administer as pharmacists.
So, right. Yeah. Oh, that's interesting. So in Canada, we of course, we did the influenza vaccines. We can do the COVID vaccines. We can do shingles vaccines. There is a few others that have been added to our full scope. And because we don't do them that often, I can always get you the full list or point you to the direction if you want to send Elissar your details, and I can follow up with you. But really our focus recently has been COVID and influenza vaccines. So that's, I think before in pharmacy, depending which pharmacy you would work at, I didn't do a lot of vaccinations, but just during the pandemic, it's like I would even go on, like usually on just a pharmacist who would work on the weekends, you wouldn't really be running a clinic, but during the pandemic that all changed. So I would go in on the weekend, have to run a clinic at the same time as dispensing, and it was all fun. You learned a lot in a short time.
That's really interesting because we also mostly do like flu vaccines and COVID vaccines, especially COVID vaccines recently. There's also another question from Reem. Is the resource Informatics for Pharmacy resource that you mentioned earlier available to use in Australia?
I believe so. If you want to also, send through your contacts, or I can just send you the link. I know a lot of the content is still Canadian specific, but there is a lot of good, just higher level overall informatics details in there. And I believe it's open to be shared. I'll double check with the AFPC, which is the Association of Faculties of Pharmacy of Canada, who I worked on with that project, and I can send that through.
I think that'd be great. And also there's a not follow-up question, another question. How's the transition to working as a pharmacist in Canada if you studied in Australia or somewhere else? I'm not sure if you do know about this, but if you do.
A little bit. So we have an international pharmacy graduate program. I believe it's a year or two. So you would have to apply to, I think, the university that has the program. And I don't know if all the pharmacies do. I mean, all the schools do. So I know U of T does have that program, and there's a certain number of graduates per year. And they look at, say, basically the number of pharmacists throughout that province, and adjust the number of applicants that they accept. And then you would go through, say, some additional courses that are relevant to Canada specifically, say, for example, like, jurisprudence type of exams. And then you would also do some, like, say, rotations, but I don't think it's like a huge undertaking where you're required to take a lot of number of courses or to have to do your degree again. It would be, I think, 1 or 2 years maximum.
Great, thank you. I think we'll move on to the next speaker just because I'm mindful of time, but thank you so much, Seema. And I know you and Aaron joined us at around 6 a.m. So I really appreciate it. And I'm sure all the students really appreciate it. And I personally really enjoyed the presentation. So I'd now like to introduce our next speaker. So Jochen Pfeifer, you can also call him Josh. I had the pleasure to meet with Josh a week or two ago, and we're planning some exciting stuff for you guys. But just regarding today, Josh is a registered pharmacist in the Velbert, Germany, and his family has owned a community pharmacy for over 120 years, which I found really impressive. And he's earned his PhD in public health at the University of Bremen in Germany. And his specialties are international and comparative healthcare and pharmacy systems, as well as interprofessional cooperation. So I'll hand it over to you now, Josh. I think you're muted, Josh.
Can you hear me now?
Yes, now we can.
Okay, sorry about that.
Thank you.
Can you see my presentation now?
We can only, oh yeah, now we can. Yes.
Okay, great. Well, thank you very much for inviting me. Greetings to Australia, US, Canada. And I'm very excited. Thank you for the invitation. Thanks to my co-hosts for the very interesting presentations. And I had to smile a little bit because something you guys mentioned as, well, something normal for you is not normal for us here in Germany at all. And I will come to that a little bit later. I'm very excited about the possibility to tell you a little bit about the German system here. Now, Germany is, of course, much smaller than Australia, Canada, and the United States. If you can see here with my mouse, I live here between Dortmund and Cologne in the western part of Germany, not too far from the Netherlands. My journey into pharmacy, I studied pharmacy at the University of Düsseldorf, but I didn't start with pharmacy. My very first intention or interest was something completely different. It was law. And back then, when I started, as you can see, I'm a little bit older than everyone else of you. Back then with us, if you studied law and got a law degree, you couldn't continue studying pharmacy. And after long discussions with my parents, I decided to switch over to pharmacy, and I'm very happy about that I did. But I just want to tell you, my very first publication is a subject which really doesn't have much to do with pharmacy. It's international liability for damage caused by space objects. I wrote that in Geneva a couple of years ago, 40 years ago. Now, I own my pharmacy here, which has been a family business for 120 years. We were founded in 1902. Now, I have the luck of doing something special with the United States in Florida and Gainesville. So you are from Florida as well, Aaron, so you know University of Florida. They had back then in 2000, and they started in 2001, they had a program called WPPD, the Working Professional PharmD program. And that was a program where they invited foreign pharmacists from Germany, from Brazil, from other countries to do a PharmD without having to go through the whole procedure. It was a 3-year program where you had to be either here in Germany or most of the time for the rotations in the United States. And you were awarded a PharmD degree. That program discontinued, unfortunately, so it is not offered any longer, which is sad. We had about, I think, 40 or 50 Germans who participated and were able to earn a PharmD. And then I had this other specialty with the University of Minnesota. In 2008, we started a program, in 2009, where the Americans, as Aaron can tell you or did tell you, have a so-called rotation where you have to do a 1-year rotation after graduating from high school. In the United States, it's I think 8 terms of 5 weeks each. In Germany, it's 2 terms out of 6 months each. I will come to that a little bit later. And we were able to do a cooperation with the University of Minnesota where we offered American pharmacy students from Minnesota to do a rotation for 5 weeks as an elective here in Germany. And it was very interesting. It started in 2009. Unfortunately, we had to stop it over because of COVID. And but I hope it will continue when the situation improves. So I'm very honored to have that. So this also explains a little bit about my interest. We were also working with these international student organizations, IPSF, and the German National Association of Pharmacy Students. We are offering students from all over, from Australia, New Zealand, Canada, US, placement here in my pharmacy where we could introduce them to the German pharmacy system and international pharmacy. I have a little provocative inspirational quote, and I hope you don't get angry at me. It says, the physician thinks, desires, and orders. The pharmacist obeys. Of course, with discretion, intelligence, and skill, yet at the end he obeys and does not originate. And that was by Abraham Flexner. He was a librarian in Boston, Massachusetts in 1915. So a little bit old. But I use that because I always tell my German friends here especially, we are not the servants of the physicians. We are, and as Seema just said, one of the most trusted and accessible healthcare professionals. And I think we have to get rid of that idea that we don't originate, or if I may quote Aaron, how difficult is it for you to do the job you're doing? Well, it is, as we already heard, very difficult. And I think, and I will come back to that quote at the end of my presentation. In Germany, it's a little bit different than in Australia or especially USA and Canada. You don't have to have a bachelor degree, like Aaron said, you don't have to in the United States, but most do. You study at the moment 8 semesters plus 1 year of rotation. The basics until the first state examination is natural science, chemistry, biology, pharmaceutical analytics, biology and technology. And that is basically what you guys in the US or Canada would, or in Australia would do if you do a bachelor in those sciences. Then you do a first state examination, which is multiple choice only. And then after you pass that, you get in the 5th semester and till the 8th semester, and you have pharmaceutical, medical chemistry, pharmaceutical biology, technology, pharmacology, and clinical pharmaceutics. When I graduated 200 years ago, we didn't have clinical pharmaceutics. And I'm very happy that they changed that, and we are now offering it to our young colleagues, and I will come back to that a little bit later. After the second state examination, you have a mandatory 1-year rotation with a minimum of 6 months continuous practice in one community pharmacy. And then you have the third state examination, and afterwards you apply without any more examinations like you in Canada you have to do in the United States, where you have to pass an exam. In the US, it's either the state examination or then the law examination of your state. We don't have that. You apply once you pass the third state examination, you can apply and you get your degree, unless you are physically not able to perform that. Okay, now how Germany lives in the pandemic. I thought, and I was right, that my predecessor presenters would present the most details of COVID, how it developed and so on. So I skipped that because we had the same situation in Germany as you guys had in Australia, Canada, and in the United States. I have presented here some details from the 11th of April from the Robert Koch Institute, which is like the CDC, Center for Disease Control in the United States, or the Canadian organizations which are in charge. I think you in Australia, you in Canada, and in the US have the same data. Maybe interestingly would be our vaccination rate. As you can see, we have about 70, so 2/3 of the population are vaccinated at least once. Depends in some states here, especially in Western Germany, it's more. In some states in Eastern Germany, it's less. It depends, but basically, I think we should get more. The interest in getting vaccinated is in Germany at the moment decreasing rapidly. In my town, they are closing test centers, they are closing vaccination centers, not because it's not necessary anymore, but because the interest is not there anymore. Those who wanted to get vaccinated got vaccinated. Those who didn't get vaccinated don't want to get vaccinated. So it's now very important that we still tell the population, even though Germany has not the strict rules anymore as we used to. This weekend is Easter. It will be the first Easter for 2 Easters now. The third Easter, 2 Easters we didn't have anything. So it was a lockdown and you couldn't get maybe to your relatives, and even then restricted. So now you can travel anywhere, even to Australia, Canada, US, no problem, it's permitted. But then what happens to the incidence rate? I don't know. And also in Germany, it's not now mandatory to have masks anymore, unless you go to a hospital, unless you go to a nursing home or to a physician, or you use public transport. Otherwise, mask mandate is not, it has been lifted in Germany. It's same more or less in the majority of states in your countries. Now, what are the roles of the role of the pharmacist in that pandemic? We had the same problems you guys had in Canada and the US: lack of staff, lack of medication supply, financial damage, especially for the colleagues who had their pharmacy in the main city centers or in shopping malls, because there was a shutdown, nobody could go shopping. But I want to concentrate on something which is maybe interesting to you who do not know the German system. And therefore I had to smile. I may quote Aaron, who just said, and you now understand if I tell you why I smiled. We had, of course, administration of vaccines. In Germany, pharmacists were until very recently not permitted to administer any vaccine. The physician organizations opposed that to the fullest extent. They still do, by the way. In Germany, pharmacists were not allowed to administer anything, They were not allowed to order tests, which got paid. They were not allowed to do corona tests, like antigen tests, prohibited. Then the system showed the others who were permitted to do that couldn't do it. So, and this is, as Seema said, we are the most trusted and accessible healthcare professionals. What did we do? Well, we did something nobody else in Germany could do at the beginning of the pandemics. We supplied the disinfectants. Where would you want to get them? You couldn't support the whole German population with the disinfectants you had at Walmart or in Aldi. It wasn't available. So the pharmacists produced them in their labs. Big pharmacies even produced in industrial style. Next thing was the supply of masks. We had no masks. And they couldn't get it, government couldn't get it. So the pharmacists were given the charge to distribute masks to the populations. And we had a couple of months where all the patients could go to a pharmacy to get those FFP2 masks for free. Who did organize it? The pharmacists. What are we doing now also? That in Germany, you need now a digitalization of your immunization record. You cannot just show the record you have on paper. It has to be digitalized on your app. Who does that? Well, theoretically, the physicians do, yeah. Theoretically, the vaccination centers do, but they were overwhelmed. Who did this? The pharmacists, in very, very short time. And that is something which I think we would really support our colleagues for that. But, and I'm very critical, as you can see, to my German colleagues and also to my colleagues in Australia, Canada, and US, don't trust our payers. They tend, I said for politicians, but it's for any payer. They tend to forget things very fast. They need us when they need us. But if they don't need us, we are just costs. And we have the situation right now with the social health insurance. In Germany, the payment is a little bit different than in the US or Australia. We don't have any state-run insurance, but it doesn't matter. Basically, there's a payer who doesn't want to pay. You know, they want to cut costs. They can't touch the physicians. They are too powerful. So like Aaron said, with the PBMs, we don't have those, but the situation is worse enough in Germany, even without PBMs. And they suggested already, the Ministry of Health suggested, they should cut the amount pharmacists are paid by about $2 per prescriptions, because the social health insurance or the payer have to save money. And I tell you guys, after all we did in the period of COVID, so, and that's why I said, German community pharmacists should not believe that politicians or the payers will be grateful. They won't. And I'm very interested maybe in the discussion to hear if you have the same fear for your payers, or would you say, well, they won't do that to us. Now, what is the situation afterwards? And again, Aaron, I had to smile again. You just mentioned so nicely collaborative agreement. That we don't have that in Germany. What you guys in Australia and Canada and US have, we don't. Physicians won't, or the, let me put it this way, physicians wouldn't be too happy, but I think we are on the right track. The young generation of students, the young generation of young professionals, and also the young generations of board members are not as stubborn as my generation was or is. So I think we should try to do the same thing. You guys in America should get the provider status. We should get a collaborative practice agreement. You all know in Australia and Canada what that is. I will explain it to my German friends later. So that is really something we should do. The same thing with immunization. Can we keep the right to immunize patients? We can at the moment only immunize against flu and COVID. Or would they say next year, when COVID has been hopefully not as bad as it is now we go back to the physician, they can only immunize. Now, the German board of pharmacy boards, and also the German student association of pharmacy students in Germany, they are planning, that was just published as a leak, a new plan for a new pharmacy curriculum, a 5-year study, so 1 year more, with less chemistry and more reliance on clinical care and clinical pharmacy, and more flexibility for the rotation of the German pharmacy students. That was just released a short while ago, 2 days ago, in a German online pharmacy magazine. As said, that's not officially confirmed yet. Message. Community pharmacist, I couldn't quote it much better what Seema said. Most trusted and accessible healthcare providers. I would say we should go from product-oriented suppliers. We should go to patient-oriented healthcare professionals. That's what we are. And I think that's why we all chose our profession as we have. We should maybe, and that's therefore I'm very, very happy for organizing such a conference. We should try to implement international best practice standards. The Australians shouldn't implement the US or the German system. The Canadians shouldn't implement the Australian system. But we should look at these standards and say, hey, is there something we could use in our country? And if so, how? Yeah. And I think that we should go, and as my hosts or my co-host, sorry, already mentioned, interprofessional cooperation is extremely important. The physicians are not our enemies. They are our colleagues in order to help us all to do what we chose as our profession, to help our patients. And I think with the young generation, with you guys, I'm sure we will succeed. So do not obey, but originate. Thank you very much for your time and attention. Thank you.
Thank you, Josh. That was such a great and inspiring presentation. And, going back to that quote, it's quite disheartening considering the past 2 years and even before the past 2 years. And, especially when you mentioned the vaccination, like we're the ones who counsel patients on how to use their injections, yet we can't vaccinate with what you were mentioning. So that was a really interesting presentation. Thank you for that. Do we have any questions from the attendees? Yes, there is a question. So was there a reaction from the pharmacists with the decision to cut down the $2 per prescription?
Yes. Oh yes, there was, and the Ministry of Health said that was a leak which got out too early. We are thinking about it. So someone put it to the press too early, but let me tell you, that was not a leak. They did it on purpose. It's my opinion, because they want to please the payers. We do have, because of COVID, of course, a situation where they don't have much money anymore. So they are looking where could they cut. They cannot cut with the hospitals, because then the local officials are, like the mayors or the premiers in your country, are at their throat. They can't cut with the physicians because they are too powerful. And the pharmacists, unfortunately, usually they start cutting with us. And I hope now, with my young generation now in charge, they won't be able to do that. Hopefully they won't, but I'm not sure.
Thank you for that, Josh. If anyone has any more questions, just because I'm mindful of time, please feel free to send them through. And would you be happy for me to send them to you and then send them back to the students? If anyone has any more questions? So Josh, would you be happy for me to send you the questions?
Yes, please.
I have? Okay, all right.
Thank you.
Thank you very much. And that was such an inspirational presentation. Thank you for coming today. I'll move on to our last speaker for the night, or for the day, depending on where you're from. So Christine Val is a community pharmacist who graduated from the University of Sydney, and she'll tell you more about her journey shortly. She's been working at Chemist Warehouse, which for those of you who are not in Australia, they're pharmacies that operate as chains. And she's been working there for around 7 years now. And I've had the pleasure to work with Christine in the past. And I know that during peak pandemic and peak lockdown, she really went over and beyond to make sure that patients were provided with the best care that they needed. So I'm very glad that we were able to join us, and the floor is all yours now.
Yeah, all good. Thank you, Elissar, for the intro. I'll just get maybe Josh to stop sharing his screen so I can share.
Oh, I'm sorry. I do apologize for that.
That's
Sorry.
all right. All good. Are you seeing my screen? Can you see my screen, Elissar? Yeah, perfect. Okay. So I'll be speaking about my how we lived the pandemic from an Australian point of view. So firstly, I'll just tell you a bit about my journey with pharmacy. So I did the Bachelor of Pharmacy at USyd, and I was in the class of 2017. Afterwards, I did my year of internship also at USyd. The year after that, I did my vaccination course. So back when I was doing pharmacy, the vaccination course was separate to the degree, but I think now they incorporate it as part of the final year. So I did that vaccination course in 2019. I started working in the pharmacy as a pharmacy assistant in my second year of study. So I found that really helpful in like learning about like medications and pretty much learning about what pharmacists do, because when I actually started pharmacy, I didn't even know what a pharmacist was, and I really fell into pharmacy by accident, just like the previous speakers' experiences. So I interned in 2018 and I registered at the end of that year and started managing from 2019, very shortly before COVID hit. So in terms of how to be a pharmacist in Australia, so pretty much it's a 4-year bachelor's degree or 2 years master's degree with a 1-year internship. During the internship, pretty much you have to do certain hours of supervised practice, where pretty much you can do everything a pharmacist can do, but just under the supervision of a pharmacist. And during that year, you will do a written exam, oral exam, complete an intern training program, and then you're good to practice on your own. So I think during the past year or so, they actually reduced the hours temporarily just for the year because we were so short on pharmacists during the pandemic. So they decreased around 1,500 hours just, I think, last year. But I think now it's back to the 1,824. So in terms of pharmacists in Australia, I think most of the students here might be aware of what we do as pharmacists. So pretty much mainly dispense medications, provide counselling. We also, some pharmacies are able to offer vaccination services. So mainly the COVID vaccine and the flu vaccine. I think there are some pharmacists that can actually vaccinate MMR and whooping cough. But the main focus at the moment is COVID and the flu vaccines. Also, we can do simple compounding, like medication reviews and blood pressure monitoring. The scope kind of varies depending on pharmacies. Obviously, some pharmacists might have like an increased scope, but generally, once you get registered, you're able to do most of these things. So in terms of what happened at the beginning of the pandemic, so I think the first case in New South Wales was on the 25th of January. And then so pretty much that's the day before our Australia Day. And we came back from our long weekend and realized our shelves were empty. So everything from toilet paper to Panadol, hand sanitizers, our shelves were bare. And what we do when the shelves are bare, we go to order it. But when we log on, we realize that it's actually out of stock from the supplier as well. So it was a very stressful time for us as healthcare professionals. When someone comes in with a headache, you can't even give them Panadol because the shelf is empty, and there's no other alternative because the Nurofen is also empty. So it was a pretty scary time, and no one really knew what was going on. So when something like that happens, you can either fight or flight. And I guess we didn't really have a choice because we had a duty of care to the patients in the community. So we got to fight it. So we had to go search out multiple suppliers. And the thing is that a lot of things were actually increased in price overnight, but we needed to have the hand sanitizer in the store. So we pay even more than what we were selling just to get that stock on the shelves because people needed it. So I think in terms of the pandemic, I wouldn't say it's over yet, but things have changed a lot since it first started. The very beginning of the pandemic, so beginning of 2020, we had lack of access to PPE as with the other countries. For us, masks were already in short supply because we had bushfires at that time. So there was a lot of air pollution, and a lot of people, for example, with asthma, they were requiring masks to just walk on the streets. We had a lot of pollution. Our skies were like yellow just from all the bushfires happening at the time. So it was really hard to get access to PPE. And a lot of medication shortages. The very beginning, we also had issues with staff shortages because the quarantine requirements have changed so much since it first started. At first, I remember one of our first COVID cases in the pharmacy. We got a call from New South Wales Health, and they told us someone with COVID entered the pharmacy. And so my boss had to check through about 3 hours of footage to find out what time this person came in. Luckily, he was only in there for like around 5 minutes. He came in, grabbed a Panadol and left. So every single person who spoke to that customer had to go into 2-week isolation. So we were lucky that it was only one person who spoke to the patient. But soon we got another case, and because of the people being in quarantine, we had an increased workload if it wasn't already increased from all the people coming in to panic buy. So the other thing we noticed was a lot of medical centers around the area were closed, probably because of the fear and the safety. And it took a while for like telehealth to pretty much come about. So a lot of patients were coming into the pharmacy with a panic. They were running out of their medications, and we still had to stick to the law. But luckily, they've changed legislations pretty much every day during that period of time. We literally had to be like watching to know what was happening next. We'd have to know like daily reports what was happening the next day. So they've loosened up some of the legislations, allowing pharmacists to be able to provide more things without having to consult the doctor, for example. We also had a time where we had to do surveillance testing. So if people lived in a certain local government area, so similar to like the bubbles, as Seema mentioned, people would have to come to work, they had to get tested every 3 days. And it was very difficult for a lot of people because at that time, the lines were so long to get tested as well. And also with the health advice, so they'd advise people to get vaccinated, but it was difficult to book in for a vaccination because not many places were doing it. And then they said that you can get rapid antigen tests. But at the very beginning of the pandemic, no one was providing rapid antigen tests. So it was a lot of like with health advice, the Premier would say something, but in reality, it wasn't very practical because what they've recommended wasn't actually available for us to access. So in terms of the role of pharmacists, we played a big role in patient education. A lot of patients were coming to the pharmacy being very worried. But on the flip side, there were also people coming in saying that this is a joke, it's just the government's way of controlling you and all that, being like very against vaccinations, against mask wearing. And so we had to educate patients on what we believe was correct and provide them all the information so that they can make an informed decision. The government for New South Wales implemented a lot of things, for example, home medicine deliveries. So they subsidized for a lot of people with chronic health conditions, who might be pregnant, who might not be able to leave their homes. So that helped a lot of people, especially if they were isolating and unable to leave their house. We did have around a 3-month lockdown at one point where if you were part of a local government area, you weren't able to leave your local government area. There was also times where we actually ran out of stock of Ventolin, which is a life-saving asthma medication, and the government actually introduced that we have to dispense for the supplies. I think there was also misinformation of people believing that it can help them with COVID because it's a respiratory disorder. So I think we had to get rid of a lot of false beliefs during that time, with people thinking they'll be safe if they have a Panadol and a Nurofen in their closet, even if they don't have asthma. So one of our big things we had to do was making sure we ordered enough to keep up with the demand. And of course, we also we had to do the vaccinations for the flu, because during that time when the first wave happened, it was also a time where the flu was coming up. So we're worried about people getting both flu, COVID. It's hard to tell because at that time there was no testing. So we had to prevent the flu and then tell people that it's important to get vaccinated. Also, because of a lot of doctors moving to telehealth, patients weren't able to get their blood pressure monitored. So they'd come to the pharmacy and we'd be that first line access to things like blood pressure monitoring. And during that pandemic, there was one thing that we did a lot of, it was taking phone calls. So at one point I was like, we need to hire a receptionist, because people would call up every day, and just sometimes it wasn't even just for advice. I felt like after months of lockdown, people were lonely. They just wanted someone to talk to. So we did have a lot of, I would say, a little bit of unnecessary phone calls at times, but I think it was important that we were there to be able to take those phone calls. So yeah, it was pretty hard to keep up to date with all the legislation, with things, for example, our continued dispensing was expanded. In the past, we were only able to do certain medications, so only cholesterol medications and the pill. But during that time, they actually extended it to a large area. So they actually extended it from the bushfires, because a lot of people were affected with lack of medication, because their houses burnt down, things like that during the bushfires. So they extended that. So we're able to help people who weren't able to see the doctors during the pandemic. Also, we had to keep up with our training. So with the COVID vaccination training, we had to do those modules, and within a short period of time, because we had to quickly order the stock and start injecting people. So I'll just end off quickly what happens when, as the previous speakers have mentioned, pharmacists are rated as one of the most trusted health professionals. So patients see us more than they see their doctors, more than they see any other healthcare professional. So it's important that we have to think about why even though the government has taken away some of the restrictions, we have to think about why they did it in the first place. So even though mask wearing is no longer compulsory, vaccinations are no longer mandated, it's still important to educate people on what is the best health advice. And then lastly, just make a difference. So probably this is on theme with what the other pharmacists have mentioned. It is your reaction to adversity more than the adversity itself that determines how your life story will develop. So it's important that we make a difference. And although the COVID was a difficult thing to deal with, I think if we can make a difference, even just to one patient's life, we can help make the world a better place. I'll now just end it there.
Definitely. Thank you, Christine. And I think a lot of students, we do have a lot of students from UCIT, and you were where we were just a couple of years ago. So I think a lot of students are going to relate to that. And it's interesting to see all the similarities and differences between the experiences of pharmacists here and overseas. Just before we wrap up, does anyone have any questions?
I have a quick, sorry, I saw that Jack put his hand up, but I'll quickly ask my question. I just wanted to know how you manage medication storages and shortages, sorry, and how you would recommend alternatives to patients when you had those shortages.
Yeah, that definitely was a big thing because you can't just leave a patient without their medication. So for us, it was a little bit of foresight. So because we had access to a few ordering places. So if our main supplier was out of stock, we'd try to source it from alternate places. The other thing really good about my workplace is that we can actually see what other pharmacies have. So a lot of the time, even if we weren't able to get the stock in, we were able to refer them onto someone who did have stock. And I think in very emergency situations for certain medications, depending on what it is, we might have to call the doctor to switch to something similar, or in some cases, refer them to like a compounding pharmacy if the product's not commercially available. But in most cases, like this, it was like difficult to get the stock in, but as long as we're able to recommend something similarly suitable. But yeah, it definitely was difficult. But like if we have enough stock, for example, we just had to order, for example, for a month, just expecting, but at the same time, not panic buying to the point that other pharmacies don't have stock. So it's a bit of like a balance.
Awesome, thank you.
I think we've lost Jack, but if you do have any questions.
I'm still here.
Oh, there we go, there we go.
Sorry, I'm just driving. I'm sorry if the sound is terrible. I just really wanted to listen to this talk. I just had a quick question regarding the concerns that the people had coming into the pharmacy. First of all, what type of concerns did they have? And where do you think these concerns stemmed from? As in, do you think they stemmed from misinformation from online sources, from the community propagating these misconceptions? And how would you go about addressing these concerns? Like, from which angle would you address them?
Yeah.
Thank you very much.
Yeah, thank you. That's a good question. So in terms of that a lot of the time it was really misinformation. So they'd read something on some article online and be like, oh, I really need this medicine. There was also a few like articles saying, for example, they would see online that say Stromectin or ivermectin was used to cure COVID. So they'd come in and they'd be like, I need this. There were actually even doctors writing prescriptions for themselves. And obviously the government knew about that beforehand and they warned us about it. So they'd inform us that we have to like check the indication to make sure it's suitable before we can just provide the medication. So I think there was a lot of misinformation, and I think that also comes from panic. So they were worried if they got COVID, what happens, and then they'd like pretty much talk around, read articles, and then come in. And so I think there was that one, and there was also Plaquenil and Ventolin were three of the most widely like thought of things that would like cure COVID. So I guess a lot of the time is just educating patients. Sometimes there was actually one elderly man one time, he was waiting in line for COVID testing, and he was waiting for so long that he actually came into the pharmacy, which actually caused panic in the other people in the pharmacy because they were worried he had COVID, but he was just waiting in line for so long and he didn't know what to do. And obviously the pharmacist is the closest by, and he just wanted to come in and just ask a pharmacist opinion. But like, luckily he wasn't like COVID positive, or he was just worried he was a close contact. But like at that time, the definitions for close and close contact it's a lot different to what it is now. But yeah, I think most of the time, like once we've explained to the patient kind of what we believe to be correct, it kind of just gets rid of a lot of the panic. I think even more recently there, when the COVID waves started happening again, on the news, they asked people to keep some Panadol and Nurofen at home. So people would come in and just say, I need to buy phenylephrine because the news told me to, and they wouldn't even know what it's for. And they'd pick like 2 different brands and they'd just not realize it's the same medication. So like there's a lot of like educating that we have to do for patients.
Okay, so I think that brings us to the end of our talk tonight. Thank you to the 4 of you for the presentations. I've certainly learned a lot, and I know the students have. And I'll thank you all again, Aaron, Seema, Josh, and Christine for coming, and Rita for also joining in today. You're all really, like, I've learned so much, and I think you have such an inspirational journey, and the students will learn a lot from today. So thank you. Just before we end the meeting, would I just be able to take a screenshot? Whoever wants to turn their camera on, feel free to turn your camera on. Otherwise, I'll just take a screenshot of whoever has their camera on. 3, 2, 1. Well, thank you all. If you do have any questions, please send them to the SUPA email, Instagram, or Facebook, and I'll forward them to our speakers. And thank you again. You have all been wonderful, and I hope you enjoy the rest of the evening.